also recently tested positive again for the second time, if I'm not wrong.
Yeah.
So are these kinds of reinfection cases common when they come through hospitals? And is there some kind of statistic or number about the reinfection rates?
Generally, the reinfections are about 5%. And people get infections after taking 2 doses of the vaccine. I mean, I had my second dose a month ago. So I've gone completely by the book. I've not taken off, of course, now sitting in a room all by myself, but I've not taken off my mask for pretty much the entire year or year and a bit. So I've gone by the book in every which way, but because I'm quite continuously exposed to potentially infected patients all the time in the hospital, we've obviously not stayed home much for lockdown or anything else, except during the period that I had the COVID myself. So I get exposed to people a lot. So I guess I just acquired the infection. Basically, vaccines work. And what the vaccines do is prevent severe disease and death. So I think that there should be no misconception, no misunderstanding about the effectiveness of vaccines. Vaccines must be had by everyone who's eligible, and they are an absolute must. It's only then that this whole thing can become like a mild flu at worst. And that's when the transmission in the community will stop and we will get over the pandemic.
If somebody does test positive or somebody has symptoms, what is your advice to them, especially given the stage that we're in where hospital beds are not available, oxygen is not available? And so what are some things that the general public should keep in mind during this time?
First thing to do when you test positive for COVID is not to panic. Isolate yourself in your own home space and connect with a physician. There are any number of online services, medical healthcare services available. I mean, it's very easy to connect to some. I mean, I know lots of doctors who are not in big hospitals who are regularly seeing 20, 30 patients online, COVID patients online every day. So I'm sure that most people will be able to connect to good help. So that's the second thing. So isolate yourself, connect with a physician, and then you have your medicines under supervision. There are any number of mild COVID protocols floating around on WhatsApp. So it's like, if I wasn't a doctor, I had this thing on WhatsApp from a friend of mine whose doctor had prescribed him that. So I just go and buy those tablets and start taking them. But that's not done. Okay, you have to connect with a physician and do it under medical supervision. So that's number 3. You start yourself on the treatment protocol under medical supervision. And then if on that treatment protocol, if you have breathlessness, if you have oxygen saturation less than 94 on 2 or 3 measurements, if you have high fever for more than 7 days, or if you have altered alertness or mental confusion, or if you have chest pain, or if you have uncontrolled vomiting or diarrhea, you're not able to keep anything down and you're getting dehydrated, those are the circumstances in which you need to go to a hospital. Unless you have any of those symptoms, or if you're like 65 plus and have major comorbidities, diabetes for 20 years, or serious heart disease, previous bypass surgery or something, or chronic liver disease. So if you're in that category, age group and comorbidity category, then the threshold for admission has to be lower. That means you have to go to hospital, maybe at an earlier stage. But otherwise, unless you have any of these, which I just enumerated, you really need to be treating at home. And that's treatment under medical supervision. Don't rush to a hospital. I think that 20 to 30% of the admissions in hospitals are unnecessary. So if those people were to be treated at home, we would have 20% more space in hospitals for serious patients and be able to save more lives.